All right, part 3, where we will see some really cool things. Again, I think we can think of the ovarian cycle and the estrous cycle as being very similar, but it's probably better to think of the ovarian cycle as just discussing the changes that take place in the ovary. The estrous cycle also includes behavioral changes, and we also start to ask questions like, well, why do horses only cycle in the spring and summer? Why do sheep and goats and deer, they only cycle in the autumn? Why is that? Which animals cycle year round? Which animals only cycle a couple of times a year? And again, by cycle, I mean that process of a follicle developing, ovulating, and the corpus luteum in humans and cows and pigs. That happens one after another. Um, the, it never stops. But in the dog, that process only occurs maybe twice a year, and the rest of the time the ovary it's like the corner bakery right now. It's shut down. There's nothing happening in the dog ovary the rest of the time. In the winter and the fall, in your horse, the ovary is doing nothing. There's no corpus luteum, there's no big follicle. It's just a quiet little ovary. But in human females, in cows, in sows, there's always, the cycle is back to back. So we'll talk about that, I hope. Okay, this is a video. You know most of this, but I want to show this to you because a big part of our job, if we work with dogs and cats, is client education. And you'll meet lots of clients who will say, oh, I just want him or her, not her, not him. I want my dog or my cat to have just one litter of kittens or puppies. Some people will say, I want my kids to experience the beauty of birth. Or it's not natural to spay them. And while I really am sympathetic to those statements, I don't say this to them, but I want to say it's also natural for some mothers to eat their puppies or to crush their puppies or to be unable to give birth. And now you have a $2,000 visit to the veterinary clinic. Not to mention the fact that if they have 10 puppies, well, now there's 10 less homes for those dogs at the animal shelter. So I try to be nice, but I also try to advocate for the owner and their dog and the animals at the shelter. Part of my job is to protect the owner. And if they find themselves with a $2,000 a treatment plan that they're not ready to pay, that's not good. Anyway, so this video I think I think it's nice because it will let you know all of the potential headaches that can take place if you don't spay your dog or cat or neuter your dog or cat. And see if you can, he's a very nice narrator, but see what you notice that he's saying.
Hey, I'm Dr. Ted Burkhart with Affordable Spay and Neuter. I would like to share some information about what happens when female pets who have not been spayed go into their first estrus cycle, or heat. Estrus is the stage in the female reproductive cycle during which she becomes the most fertile, and usually when she is the most receptive to mating with males. Physiologically, the estrogen levels first increase sharply, then decrease, and mature eggs are released from the ovaries in preparation to get fertilized. Dogs and cats can have different modes of going into estrus. Dogs generally tend to have a regular heat cycle about every 6 to 9 months. However, each dog has their own unique cycle, which can vary. In general, they tend to be about once or twice a year when they go into heat. Cats are induced and spontaneous ovulators, which is different from dogs, meaning that instead of having a predictable cycle, they are induced to go into heat by external factors. Common external factors include season, temperature, and number of daylight hours. Other factors that can induce estrus are coitus, auditory or visual stimuli, and even smells and pheromones. Dogs typically have their first heat around 9 months of age, which can vary with each individual and breed. Small breed dogs tend to go into heat at a younger age than larger breeds, and they tend to have their first heat a few months later for the larger breeds. Cats tend to have their first heat around 6 months of age, but this can also vary depending on the season. How can you tell if your pet is in heat? Externally, your female may show signs of enlargement of the mammary glands and the vulva. There also may be blood discharge from the vulva. For cats, it can be easier to tell when they're in heat because many cats have a dramatic behavior change. They become more affectionate with their owners, sometimes even demanding attention, rubbing and possibly rolling on the floor. Many cats will also tend to yowl, act very needy, and may even spray urine to mark surfaces in the house. Females also tend to attract male cats, who you may notice start coming around, hanging out at the house, and yowling for affection outside your window. Cats usually stay in heat for 1 to 3 weeks, but their behavior may continue as they are repeatedly induced throughout the breeding season. Dogs may show the same external signs of enlarged mammary glands and vulva as cats, but they don't always, and it can be more difficult to tell when dogs are in heat. Some female dogs may initiate sexual interaction with other dogs and be more receptive to approaching male dogs. They can act nervous or lethargic, not eat as much, and have similar symptoms to morning sickness. Individual cats and dogs differ in how they behave, and sometimes there are no obvious signs that they are in heat until the surgeon notices the internal changes during surgery. Some of those changes include an enlarged uterus and enlarged uterine vessels. The best way to prevent your female pet from going into heat is to have them surgically sterilized or spayed. Spaying them before they go into heat not only eliminates the behavior changes that occur when they're in heat, but also eliminates the chance of ovarian and uterine cancer and dramatically reduces the chance of mammary cancer. So it is best to spay your female cats before she goes into heat around 6 months of age, and it's best to spay your female dogs around 6 to 9 months of age. Thanks for listening. I'm Dr. Ted Burkhart.
So he's so nice, right? But did you pick up on some of the things he said? You know, like bloody discharge. Some owners don't realize their dog's going to be dripping blood in the house. The cat is going to be attracting other male cats for weeks. So I think it's kind of important for us to let our clients know. And he also brought up some really important health concerns. Mammary glands, mammary neoplasia will not occur if we spay them before their first heat. They won't get pyometra. You won't get an unwanted pregnancy. At some point, we need to talk about there is also a downside. There are some cases where we actually want the dog, where it's okay for the dog to go through one heat because we have now found for certain breeds, if we spay them or neuter them too young, their chance for bone cancer increases. So we're making these decisions as veterinarians and veterinary technicians of like, well, um, certain dogs, we want them to be fully grown before we take away their gonads, but they'll go through their first heat when they're about 70% of their adult size. You'll notice he said that small breed dogs may go into heat a little sooner. That's because they reach 70% of their adult size sooner than a Great Dane. A Great Dane may not reach 70% of her adult size until she's 13 or 14 months old. So at least if someone brings me a giant breed dog, we don't spay her until she's over a year old because we want her to be nearly done growing. Okay, so this idea of the estrus cycle, it just refers to the beginning of one heat period to the beginning of the next heat period. A better term I should use is estrus cycle. It's a little confusing. There's these two words, estrus and estrus. Estrus with an O refers to the entire cycle and all these, and you'll learn about proestrus, estrus, diestrus, anestrus. But the word estrus without an O refers to part of the estrus cycle. Estrus, spelled E-S-T-R-U-S, refers to being in heat. It would be this part of the estrus cycle. And this is kind of a busy little figure here, but it's nice because it shows everything that's happening in the mare. The estrus cycle is controlled by the anterior pituitary hormones, like we said, LH, luteinizing hormone, and FSH, follicle stimulating hormone. They kind of work together to do slightly different things. They're going to cause one or more of the ova to mature within a follicle and be released via ovulation. They also stimulate production of hormones by the developing follicle or by the corpus luteum, the progesterone. And that together, estrogen and progesterones, they're responsible for the physical and behavioral changes that we associate in the female. So what do we mean by behavioral changes? This video shows you some in the mare, but it's helpful to also, like that first video told you, of some of the physical and behavioral changes that we see in cats and dogs. This will talk about the mare, and then I'll talk to you about a cow in just a moment. But let's watch this video.
Once mares have entered into the breeding season, they will show the typical behavioral signs of estrus. Mares will typically be graded on a scale of 0 to 4, with 0 being out of heat or estrus and 4 being very deep in estrus. The typical behaviors mares in estrus will show are interest in the stallion, passive to the stallion, urinate when the stallion squeals or approaches the mare, or lifting of the tail and winking of the vulva. Some mares will show all of these signs, whereas others will be in heat if they simply look at the stallion rather than walk away. Also, the added factor of a newborn foal can also affect the teasing behavior of many mares. Some mares, which typically show all of the signs of estrus, will become protective of their young foal and will show very few indicators and act as if they are not in heat. A good breeding manager should be familiar with the stage of each mare in her cycle and normal behavior, so they will know what to expect. Mares teasing a zero will have a very minimal interest in the stallion, often kick, pin their ears, and they may fight him. However, some mares will still approach the stallion and act somewhat interested, but still fight him. Some mares teasing a zero will even urinate, but their overall behavior is unlike one that is truly an estrus. Mares teasing a 1 or 2 could be ones that are either coming into heat or just going out of heat. These mares will show some signs, such as light passiveness, may approach the stallion, but may end up fighting or simply be disinterested. Again, it is important for the teasing person to be familiar with the mare's estrus cycle so they know if the mare should be coming in or going out of heat. They can spend more time on some mares if they know she should be coming into heat. Mares teasing a score of 3 will easily show nearly all the behavioral signs of estrus, such as winking of the vulva, raising the tail, urinating, and somewhat passiveness to the stallion. The most intensive behavioral signs are graded a 4. These mares are extremely deep in heat and will generally approach the stallion with little or no fighting. They too show all of the behavioral signs in an extreme way. Most mares will take a day or two to come into deep heat or tease a 4. They will begin as a 1 or 2 one day and then move up to a 3 and then a 4. Once they have ovulated, they will then regress and will tease a 1 or a 2 before going out of heat and teasing a 0.
So I haven't heard this idea of grading the I think that may be just a horse thing, but you saw how there's certain behaviors she shows just before she goes into heat, where she might be interested in the stallion, but she won't let him mount her, compared to when she's actually in estrus, um, when she will. And by the way, keep in mind, you may find you really love reproduction. If you really love horses, there is, well, you don't need to specialize, but you can go and work at stud ranches. You can work in breeding. You may work with veterinarians who travel around helping with reproductive problems. But there are specialties in there's not a specialty in reproduction, but in internal medicine, you might find yourself working with reproduction or specializing with horses and things like that. Okay. Sorry, hold on. And if for some reason I've goofed up and you can't see these videos, you can access them all, from the original PowerPoint. It's a little, what I'm seeing on the screen is not what you're seeing, so it can get a little bit confusing. And again, I always want to just double check and make sure that you're seeing what I'm seeing. So. Okay, now we've talked about dogs and cats and some of the signs when they're in estrus. You just saw how horses they'll wink. There's certain things that the mare will do. What about cows? This came as a big surprise to me when I was in veterinary school. So here's these are all female cows, right? This is a female cow, right? There's her udder. There's It's a female cow trying to mount this female cow. And here's another female cow trying to mount and have, sex with this female cow, right? All females. Which one is in estrus? Which one is in estrus? Is it her or is it her? Well, you may be surprised. It's her, right? It's the cow being mounted is the one in heat. The one doing the mounting might be in heat, but not necessarily. It's the cow that is attracting and standing there while another cow mounts. That's the cow in heat, and that's the cow that the farmer, the rancher, is going to potentially keep his or her eye on, or have a breeder breed. Okay, so the estrus cycle, different species of animals have different patterns. They all go through these same basic stages: estrus, then into diestrus. Some animals enter a period of inactivity, like the dog or the horse at the end of summer. And then that goes into proestrus and then back into estrus. For cows, humans, sows, it goes estrus, diestrus, proestrus, estrus, diestrus, proestrus, estrus. The cycle goes again and again. And again, proestrus would be that period where the follicle is developing, getting ready. And then estrus would be when there's lots of estrogen and it ovulates. And then diestrus is the period after that. If the animal becomes pregnant, well, then diestrus is going to last for the duration of the pregnancy. If the animal does not get pregnant, then diestrus, or at the end of pregnancy, diestrus, is going to lead into either estrus, or I'm sorry, proestrus, or into a period of hibernation, or what we call anestrus. One term you need to know are these terms like uniparous or multiparous. I might not be saying those right. That refers to how many ova these species typically produce. So horses and cows and humans are usually uniparous. They usually just have the one follicle and one ovum. Sometimes they may make two, but usually it's just one. The cat, the pig, and the dog are multiparous. When they ovulate multiple follicles. I don't know if it's all at the same time or within a few minutes. I don't know. But they end up with rather large litters, usually. Some dogs may still just have one. Some cats may just have one. But usually they have multiple follicles and multiple ova. Another term that you'll need to know is monoestrus, polyestrus, and seasonally polyestrus. Polyestrus would be humans, cows, sows. Poly means many. And so like a polyglot is someone who speaks many languages, or someone who practices polygamy, has multiple husbands or wives. I don't know. Polyestrus just means they have many estrus cycles, one after another. Monoestrus, that animal is not shown here. A monoestrus animal would be like a mink. A mink only has one cycle a year. The dog would be diestrus. It usually has about 2 cycles a year. And then seasonally polyestrus means the species will have multiple cycles, but only for a particular time of the year. And that would be the horse. During the spring and summer, the horse is polyestrus, but then in the fall and winter, she stops, and she's in anestrus. Sheep and goats and deer and moose, they are seasonally polyestrous in the fall. But then in spring and summer, well, I should say winter, spring, and summer, their ovaries are silent. They are in anestrus. So let's talk about the mare. Why? Why spring or summer? Why do you think? Well, it will help if we know what her gestation cycle is. I'm sorry, it'll be helpful to know the length of her gestation. Let me just pull something up here. All right. So one hint would be what's her gestation period. The other question is, how does she know it's spring? How does her body know it's time to start cycling? Well, the horse, the gestation period is almost a year. It's about 11 months. And so she breeds in the spring or summer. She'll have her baby in the spring or summer. The goal is avoid having birth in winter when it's wet and cold, right? We want to have it when there's fresh grass growing, plenty of food, things like that. And how does she know? I think it's the pineal gland. I'm not sure. That's the gland that makes melatonin. Anyway, somehow she knows that the days are getting longer. When the days start to get longer, again, I don't know how, but her reproductive system will turn on as days get longer and longer and longer. So that's why you'll hear horses called long day breeders. As the days start to get shorter in fall, then her reproductive system turns off. What about these guys, right? Here we're seeing a bunch of sheep. Probably some have been bred and they got sprayed green or I don't know, red. I don't know why they're sprayed those colors. Actually, sometimes farmers will take a buck or a ram and they'll put a little ink, a little ink or ink cartridge on the chest or the chin, and so that if he mounts one of the females, the farmer can know because the male leaves a little ink mark. Anyway, so you see it's kind of autumn, right? Look how the farmer is dressed. During the fall, you get moose and elk and deer. The males are in rut, right? They're competing for the females, right? There's a lot of activity in the fall. Why the fall? Well, their gestation period is about 5 months, right? So she gets pregnant in the fall. She has her little baby, look how cute, in the spring. How does she know that it's the fall? Well, she's the opposite of the horse. The deer, the lamb, the sheep, I should say the doe or the ewe or whatever a female moose is called, as days get shorter, their reproductive system turns on. Anyway, those are examples of seasonally polyestrous animals. The cat is also called seasonally polyestrous, but cats, of course, are from another planet, and they tend to cycle from like January to October. They have a really short gestation, about 60 days. You'll hear people talk about kitten season, which I think is usually the spring. So that's all these cats that were not having sex in the winter or in December or November. Now they're all having sex and they're having all these kittens back to back. And so springtime, and I feel like other times of the year are called kitten season. I feel like it's always kitten season, but I think springtime is really kitten season. Okay, so so now let's kind of zoom in on what's happening in the cycle, and we can tie it in with the ovarian cycle. This is a British. Is this British? No, this is okay. So they're using the same American spelling. So the cycle is broken down into these different phases. So one phase is called proestrus, and so we'll start there. This is leading up to estrus. And these are some signs you'll see in dogs. We'll kind of focus on dogs here, um, kind of like that mare video talked about the mare. So with proestrus, there may be bloody discharge, there may not be. She will attract males, but she won't let them mount her. She'll be interested, but if they try to mount her, she may bite at them or at least run away. And again, you know, it's kind of a strange choice of words. You'd think they would call it pre-estrus, but they call it pro-estrus, kind of like, yeah, in favor of estrus. Anyway, so this can go on for, a week and a half or so, and then it leads into estrus. Now, other things are happening. Hold on here. I'm going to kind of go back and forth between a couple of slides here. Her body is getting prepared for breeding, and so something that happens is the walls of her vagina, all of the epithelial cells, normally they look like ordinary epithelial cells. They're just these round cells with a pretty big nucleus. Well, they start to change as she approaches estrus. These cells start to develop a protein called keratin. Keratin is the same protein that makes up your hair, it makes up your nails. It's actually what's in the outer layer of your skin. It's kind of it's your if you're a horse, it's your hoof. If you're a dog or a cat, it's your nails. If you're a bird, it's your beak. It's a tough protein. And that's happening in the cells of the vagina. These cells are becoming keratinized, or we use the word cornified. They're becoming kind of tough. So that starts to happen at the end of estrus, and the nucleus also dies, basically. So you get these kind of tough cells. Why do you think that is? Why do you think the lining of the vagina would need to get tough? Well, if you're about to have sex with a bull or a male dog or a stallion, it's trying to toughen up to protect itself from the intensity, or I shouldn't say intensity, of the act of breeding. So those are some things that are happening during proestrus. The follicle is developing, as more and more estrogen is being produced, and that's feeding back to the anterior pituitary. That's making more and more LH and FSH. And then suddenly, blam, we get ovulation, and she's in heat, and she will now be receptive to the male. So that little egg is making its journey down the oviduct, and we got to get some sperm in there pronto. At this point, if the cells of the vagina are completely cornified, completely keratinized, and this is when she's going to be most receptive to males. The female horse will show her signs. The cow would allow another cow to mount. Again, these are some of the signs that we see. And then after that, as the corpus luteum begins to form, then we enter the stage called diestrus. And this is going to vary among species. But let's just say in the dog, she may be in this stage for 2 months. There can still be some bleeding, not for 2 months, but there may still be some bloody discharge from the male dog. This is also called the luteal phase after the corpus luteum. This diestrus is when progesterone is going to be the main, right? That's going to be your main hormone. Oops, hold on. I don't know. I just want to write that here. So, right, so we got progesterone, which, well, I don't even know why I'm trying this. I can't draw. Oh my gosh, what am I doing? That's a waste of time. Progesterone. Well, that's helpful, isn't it? I don't know what I just wrote. Okay, so progesterone is the main hormone here. And then if she gets pregnant, then this diestrus goes on for the duration of her pregnancy, which is also a little over 2 months. Or if she does not get pregnant, then this leads into anestrus, where there's no estrogen, there's no progesterone, there's no nothing. Just the ovary is resting. And this is, I wanted to show you this. This is what the cells would look like. We talked a little bit about vaginal cytology. We would have done vaginal cytology in class this week, but we'll get a chance to practice it in the fall. So these are these cornified cells that that we talked about. They're not they look like cornflakes. So you'll hear when you do vaginal cytology, you'll hear people talk about, yep, I see the cornflakes. Lots of keratin, either no nucleus or a very small nucleus. You can see how the edges are of this one are a lot more kind of rough and irregular. We see that change. If you do vaginal cytology and you see this, it either means they're in estrus or late proestrus. Certainly, the cornflakes would mean usually estrus. But the rest of the year, during anestrus and diestrus, these are just normal looking epithelial cells with a nice big fat nucleus, nice round edges there. So they call these intermediate cells and parabasal cells, and those are not cornified. And we can think of those as looking like fried eggs. So it's cornflakes or fried eggs. When you do vaginal cytology, that's what you're looking for. And we'll talk a little more about vaginal cytology now. So you can put all of this to work. You may find yourself working as a working with in reproduction. That's one of the topics that we'll have in discussion in pharmacology in a few weeks. There are different, we can try to help animals get pregnant using, you know, some of these drugs, follicle stimulating hormone, and progesterone and estrogen, and we can help them get pregnant. We can help them stay pregnant. So we'll talk a little bit more about, we're not going to talk about biomedical research, but I guess a little bit we will, and then preservation of endangered species and increases in production. We're not going to talk about cloning. I do want you to know the very first cloned calf in California, I was the student in charge of the mother, of the recipient of the cloned embryo. But she was just kind of an ordinary cow. It was her baby that made headline news. But I was in charge of the mother, and I helped do the C-section that delivered the calf. But it didn't end well. So not my fault. It was just there was still a lot they needed to learn about cloning. Anyway, let's not talk about cloning. Let's talk about vaginal cytology, artificial insemination, superovulation, embryo transfer, and breeding soundness exams. These are all really cool. So vaginal cytology, I'm going to focus on the dog. I've never done it in cows, or maybe somebody does. Mostly we do it in dogs, maybe because with the dog, you only get 1 or 2 chances a year to breed her. And so this procedure is done very cleanly. There's a video on the Start Here page. You're wearing gloves. You want to make sure she's clean. That cotton-tipped applicator is moistened. You just gently roll it inside the vaginal vault, and then you roll it out on the slide, and you do your diff quick stain, and you look at the cells, and you can use the cells along with her behavior, her timing, to determine whether she's in proestrus or estrus or diestrus. And again, just kind of showing you in proestrus, in early proestrus, you get these cells that with the big, you get these parabasal and intermediate cells. But as we get closer to estrus, the cells start to look more like these cells that we see in estrus, where now there's the nuclei are very small. The cells are they look more like cornflakes. And then certainly the rest of the year, and ignore met estrus. Wherever you see the word met estrus, just ignore it. It's a useless term. Diestrus, we're back to these parabasal cells with the big nuclei. It's also kind of interesting that there's, they mentioned that there's more red blood cells and neutrophils at different stages, but we're not really gonna. I want you to learn about the cells themselves. So for example, a client brings you this dog. She's got a swollen vulva. They have a little dime there just to kind of give you a comparison. So there's her vulva. There's some bloody discharge. The owner says this has been going on about 2 weeks. She seems receptive to males. You do vaginal cytology. And what do you think? Are those fried eggs or cornflakes? That's right. Those look like cornflakes. And just based on her behavior, we could probably say she's in heat. You should breed her. Sometimes we do this with artificial insemination. Sometimes there's different surgical procedures we can use. Sometimes we actually will measure her progesterone levels. I used to do that fairly regularly, but to be honest with you, now I don't remember what I did. But if I had to, I'm sure I could relearn it. If he said, it's been bloody discharge for about 7 days, and she's not receptive to males, and this is what you saw, we might say, well, these cells are becoming cornflakes, right? They're becoming cornified, but there is still this nucleus. Her behavior, we'd probably say, come back tomorrow and we'll do cytology again. By the way, some owners do cytology on their own. They may ask you to teach them how to do cytology. That's okay. They might buy themselves a microscope and some diff quick. They can do this themselves, and you could teach them. So that happens. There's all sorts of YouTube videos where people are self-taught. Remember, let's talk about artificial insemination. So you remember Mike Lewis came out and y'all bred Madge. Well, you weren't here for Madge, you were here for honey. Is that right? Anyway, so it's kind of interesting to see what he was doing. You could do this. You could do this with cattle, with horses, with goats, with pigs. We even do this in dogs. But this is a particular way of doing it in a cow, and I think this is interesting.
We recommend that your cows are AI'd by an experienced technician. The AI tank contains liquid nitrogen that stores the frozen semen straws. The technician removes the straw from the tank and thaws it in a water bath at 35 to 37 degrees. The technician removes the straw from the water bath, dries it. He then loads it into the insemination pipette, also known as the AI gun, and cuts the end off. A sterile sheet is then placed over the gun. It is now ready to inseminate the cow. The technician places his arm into the rectum of the cow and grasps the cervix. The cow's vulva is cleaned. This can be done with the handle of a Q-mate applicator and/or paper towel. An assistant parts the lips of the vulva, ensuring a clean pathway for the AI gun. The technician inserts the AI gun, pushing upwards, starting at a 45-degree angle and ending horizontally. He then passes the tip of the AI gun through the cervix, guiding it with the hand inside the rectum. Once the tip of the gun is completely through the cervix, the technician deposits the semen in the body of the uterus by pushing the plunger on the AI gun. The cow has now been artificially inseminated.
Yeah. Hold on. I think it made it clear, right? There was frozen semen with sperm in that little pipette, and you saw he had to be pretty clean, right? We don't want to introduce manure into her reproductive tract. So so again, and that's not easy. I've tried. That is really an art form to thread that AI gun into the cervix without, it's hard to get it in there. Okay, something else, we mostly do this in cattle and sheep and goats, and that's called superovulation and embryo transfer. This is something people don't need a veterinarian to do. Some people do it. I worked for the Gallo family of Gallo wine, very wealthy family, and they had bulls and cows worth $30,000. They had trained people who, it was their own cows, so they did this on their own cows. They would get really expensive embryos from other cows and put them into their cows, or they would sell their cows' embryos. Again, it's a way of superior genetics. They're trying to find ways to do this to help endangered species. So for example, it sounds kind of crazy, but maybe taking some endangered feline species like a cheetah or a lion and somehow putting those embryos into a domestic cat. And then the cat gives birth to a cheetah. I don't know exactly, but it gets used for different things. IVF stands for in vitro fertilization. So these little cheetahs, as embryos, they were transferred into a donor cheetah, I think. And you know who would really be interested in this? The Tiger King. Yes, Joe Exotic. And it's kind of an interesting documentary if you get a chance to watch Tiger King. It's full of some very unusual characters. So, okay. So you can actually understand a little bit about superovulation. You know that ovulation involves follicle stimulating hormone and that gonadotropin releasing hormone we mentioned from the hypothalamus. So we'll just watch a couple of minutes of this video and you'll just see basically they're trying to get the cow with superior genetics, they're trying to get her to create lots of ova so that they can get fertilized, and then those embryos can go off can go off to recipient cows. And we'll just watch a few minutes of this.
Embryo transfer in food animals began in the 1930s with sheep and goats, and then began gaining popularity with beef and dairy producers in the 1970s and 80s as a way to take advantage of superior females in herds across the country. Simply put, cattle embryo transfer is a drug-induced superovulation of a cow or heifer that results in the production of multiple embryos. An embryologist flushes and collects these embryos to transfer to other recipient females or freeze for future use. After non-surgical methods were developed, it has continued to increase in use across the United States and the world.
Donor females are selected based on a number of criteria, including but not limited to pedigree, genetic value, phenotypic superiority, and production records, among other factors. These females serve as a maternal base for beef and dairy herds across the country. After the selection of a donor female, an embryologist checks her for reproductive soundness before setting her up with a series of shots. A schedule of shots is given over a 4.5-day time period to synchronize and superovulate the donor cow. During this schedule, 9 shots of follicle-stimulating hormone are given in declining dosages, with shots of prostaglandin F2 alpha given on day 4. This series of shots causes the donor female's ovary to grow and ovulate a larger than normal number of eggs. The donor will then come into heat on day 6. At the first signs of standing heat, the female is to be given a shot of gonadotropin-releasing hormone and bred twice at 12 and 24 hours following standing heat.
Embryo transfer is very detail-oriented.
Okay, so do I understand why they give the prostaglandin F2 alpha and then the gonadotropin-releasing hormone? No. I mean, I probably could, but I don't really need to. But I just wanted you to see that so you realize, oh, there's follicle stimulating hormone. They're using that to help, bring forward all these extra follicles. Okay. Okay. And then the final part we'll learn about, this is not in the book, but I've kind of adapted this from, well, no, this is not in the book. The part about vaginal cytology I took from your clinical lab book. The breeding soundness exams are done not just in the males, but we're going to talk about males. And they're not just done in bovine and equine males. You could do a breeding soundness exam on a male dog too, but I did this a lot on bulls. If people wanted to sell their bull semen, or they wanted to purchase a bull for their ranch, they would call me out and I would do a breeding soundness exam. Basically, is this guy is he healthy, and is there anything wrong where he would not be able to get cows pregnant? So we'll watch this video first. So as you watch how did they get his semen sample. Part of it is you want to look at the actual sperm. What other parts of the breeding soundness exam are we looking at? They measure his testicles. Why do they do that? And why do they rectally palpate him. It kind of ends abruptly, but we'll take a look here.
What does the test involve?
Kind of starts abruptly too, so hold on. There's the bowl. Hello. Okay.
What does the test involve? Firstly, a full physical examination. Head, heart and lungs, legs, feet, prep use to ensure that he should be physically capable of the stamina required to get his group of females in calf. Secondly, a reproductive examination of his testes, checking for the tone and feeling for lumps, then measuring his scrotal size. A kick or rump bar is needed for this, although very few bulls object to it. His testicles are basically his semen factory, so size is important. Small testicles have been associated with bulls having exceptionally good muscling. For what use is this if he cannot pass it on to his offspring because he's not very fertile, or passes on fertility problems to the offspring he does produce? We also examine his accessory sex glands internally. His penis is usually seen while stimulating him to give a semen sample. Thirdly, a semen examination. This is usually collected using the electroejaculator, which is a battery-powered probe which goes into the rectum and stimulates the nerves to the accessory sex glands and penis. Unfortunately, these nerves are right next to some of the nerves to the back legs, so the legs will straighten each time the machine is on. Electroejaculators can only be used to get semen samples by a veterinary surgeon with specific training to ensure the welfare of the bull. Then we look at the semen. Firstly, check it is not contaminated by urine and assess its consistency, which roughly indicates the concentration of the sperm. Next, we look down the microscope, looking at overall wave motion. Although this is interesting to look at, this does not correlate well with actual fertility.
Like I said, it kind of ends right there. So, so did you notice anything that kind of caught your attention? You know, they look at his feet and his legs. Well, what does that have to do with breeding? Well, if he's lame, if he's got arthritis, if he has a hoof rot, he's not going to want to mount a female. It's going to hurt him too much. So you want them to have a healthy musculoskeletal system. You saw the size of the scrotum tells you how many sperm he's going to make. So a big scrotum is important, and they're feeling for anything weird, like any lumps, anything unusual. Remember, looking is more important than knowing. They palpated them to feel things like his prostate and those other accessory glands, things that that help to make the semen, the liquid part. Make sure there's no infection or abscess or inflammation of those accessory glands. And then that weird looking torpedo, it's called the electroejaculator. And yes, it sounds horrible. It just apparently did sort of kind of mild electrical stimulation of his nerves that would make him ejaculate. So that's how you get the sample. In this stallion, you'll notice this guy's wearing a helmet. He's trying to get a semen sample from the stallion here. There is no electroejaculator in a stallion. Nobody in their right mind would put that up a stallion's rear end because they would probably get their head kicked off. But it looks like there's a female horse over here. She's probably in estrus, and that's got him all excited. So and then they call this a phantom mare. I think it's this thing he can mount so that then he will provide them the sample. So this is the same video we watched in the Start Here page, but just kind of watch it again, and again, see how she gets the sample, all the steps she takes to ensure quality. And then this one, they actually show you, let me back up. The bowl, that semen is just being thrown away. It's just being evaluated. With this stallion, some of it's being evaluated, but some of it, I think, is also going to be transferred to the mare. So anyway, you get to see that side of it too.
So I put the baby bottle liner in the cup, and then I put the baby bottle liner in the cup, and then I put the filter. This will catch the gel fraction of the semen, and it goes in the baby bottle liner. Then I put the cup on the bottle, and this is what catches the semen. This goes, it attaches to our bladder, like so, and then gets taped in place for extra security. We put our leather jacket on. Buckle it up. And we lube the inside of the bladder for the stallion. This is the insulated bag that goes over the semen collection bottle, and this keeps the semen protected from light and temperature shocks before we can process it in the lab. Let me check it first. Gel fraction. That's what we discard. And this is our semen. Here. I will put some of the semen on a slide, just a drop, so that I can look at the motility and morphology of the sperm. I am putting semen in the tube. I need 9 mils of semen. I go right up to the 10 mil line.
Now, did you notice anything different about how they did the artificial insemination? One technician did it on one mare, and then the other, and they could be RVTs, they could be veterinarians. I don't know anything about them. But did you notice a couple of things that were different? Well, one, of course, you notice they didn't have their hand up the rectum, and then the other hand, they didn't have a hand up the rectum like the cow breeder did, because one thing is the horse rectum is a lot more fragile than the cow rectum, and it's much easier to tear. So we don't, it can be done. People will do it for other things, but I just remember being told that it's a lot easier to tear. You notice this, there's a part called the gel fraction. It's kind of cool. I just looked up what that meant. It's part of the semen, but it's this kind of thick jelly, and it doesn't have any sperm, or that it doesn't serve any purpose for the breeding artificially, so they throw it out. But you'll notice, remember we said that spermatogenesis likes a particular temperature. It doesn't like things too cold. It doesn't like things too hot. And you saw how she had that giant insulating device so that it didn't get cold shock. So I thought that was pretty cool. Okay. And then you saw they ultrasounded the mare, but they didn't. When I watched, I can't tell what they're seeing in the mare. Again, let me make sure you're seeing that. Okay. And then this is a artificial, I'm sorry, this is not artificial insemination. They're collecting semen from this elephant, and this is by hand. You can see this gentleman here, he's stimulating the male elephant by hand. And that's what we used to have to do. One day I went out to a farm to do a breeding soundness exam on a bull, and there was no power. I didn't know there would be no power, and so I had to do it by hand, and I can't believe it, but it was a little tiring, but it worked. I mean, look at that. Look at what a workout. So that was the old way of doing things, and I'm kind of glad we don't have to do that anymore. And then, like we said, part of a breeding soundness exam would be to then actually look at the sperm. And so this might look a little blurry to you, but those are lots of little sperm moving around. But what we really want to do is to zoom in on individual sperm. And I don't expect you to be an expert in all of the different weird things we see, but I think it's interesting to know some of the weird things we see. Just by looking at these, you may notice, this guy seems to look relatively normal, I guess, but these other ones each have something kind of funky about them. So like this one has two heads. So let's look at some of the things that we may see. And this is not just stallions, this could be a dog or a pig or anything. So there's two particular groups of abnormalities that we would be looking for. Some are called primary abnormalities and some are called secondary abnormalities. The primary abnormalities are the most serious because these sperm will not be able to do their job. They just will not be able to swim to the ovum. They will not be able to fertilize the ovum. There's just too many things wrong with them. So they have two heads, something about having a head that's too big. That's called a macrocephalic sperm. This head is too small. Microcephalic, that one's too narrow. I mean, they're kind of subtle differences, but those sperm just will not be able to fertilize an ovum. Here's one where the mid piece is bent, like that sperm might just end up swimming in circles. This one might not be able to swim at all. It's got a coiled mid piece. This one, the mid piece and the tail are kind of off a little bit, right? They're not, it's kind of coming off the side of the head. This one has kind of a double head piece. This one's got this weird little pear-shaped head. So they're kind of subtle, but these are things we would look for when we're evaluating semen. There are other changes that we call secondary abnormalities, and these can actually be just from how we handle the sample. They may not have anything to do with the horse, but they can be genetic as well. But this would be things like no tail, right? It's just this little head floating there. This thing called a proximal droplet that we see, maybe a kinked tail. It looks kind of like some of the other ones we saw. But again, things you would watch for, a weird little droplet, a head. if you see these in low numbers and most of the sperm look normal, then that may be fine. It's been years. It's been 10 years since I've done this, so I'm a little rusty. So but anyway, just know that there are some abnormalities that may not be quite as serious. In fact, I was reading about a horse that was not able to get the females pregnant. They checked his semen, and he had some of these abnormalities, but it can also be from what's called storage disease. And if I remember, I'm going to put that in one of our discussions maybe next week. And one of you can learn about storage disease in stallions. It was kind of an interesting story, and it had a happy ending. Okay, well, now you can look at the final questions, and we will build off all of this when we talk about pregnancy and parturition and lactation. But for now, that's it for the reproductive system, and I will see you online, and call me if I can help with anything, or email me. All right, everyone, hope you're doing good. Take care.